Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be discussing the healthcare job market. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 19 years of health IT content at healthcareittoday.com. It's a weird market we're in, Colin. I don't know. I don't even know how to describe it, to be frank.
I don't think anyone can. I don't think economists can. I don't think politicians can. It's a weird time. And yeah, it's a weird time to also be in healthcare.
Well, it's weird because it's so uncertain, right? Like
Yes. Yeah.
normally it's like, okay, we're in a recession. No wonder everyone's losing their job, or, we're in this bubble and everyone's hiring like crazy. Like you kind of have some rationale for it. This one is like, it kind of feels like we're waiting for something to pop or something to like happen, like some seminal event, and we don't know what that is. And maybe it's somewhat the uncertainty of the administration, or I mean, there's lots of things I can come up with like that are uncertain. The economy's doing well from a stock market perspective, but everyone's firing all these people, and so it's like this, like there's this cognitive disconnect between stuff that's exciting and that's happening and looks good, and then stuff that just scares you because you see all the people firing. AI, it's exciting. It's the most exciting technology we've had. It's transforming so many things. It's this excitement, but then you're like, well, what does that mean for the future? So I don't know. That's, I think, the cognitive disconnect that's weird right now.
Yeah. So, just looking at kind of, you're right. I mean, there's a lot of external factors happening here and having an impact on the healthcare workforce, right? And I think we have to kind of divide it up. Like there's the healthcare workforce, the clinical workforce, right? There's like, docs and clinicians and nurses and anyone who basically provides care to patients. I think there's impact in the sense of it's the same impact that's always been over the last few years, which is there's not enough of you. There's not enough of them. We can't mint them fast enough. That is not going to change despite all the other things that are happening in the rest of the economy, right? Because, we still see today so many job openings for nurses and clinicians, right? And I don't think that's going to change over the next little while. It doesn't matter what the economy is going to do. But it's the other side of the workforce, right? The IT folks, the administrators, the people working at companies that support healthcare organizations. There, I think it's a different story. There's a lot of uncertainty. We're seeing job cuts. We're seeing some cutbacks. We're seeing some pauses on things. And I think that's what's to me when I talk to people recently in the fall conferences. That seems to be the trend I'm seeing is that everyone's just sort of on pause. To your point, waiting for something, some sort of either hopeful sign or not so hopeful sign, so they know what to do.
Yeah. Well, and throw in our Sway Health community, the marketing and PR people. There's a lot that are struggling there too to find the right jobs. I think it's because of the uncertainty, although some of that feels very certain that IT budgets are being cut at healthcare organizations, right? So you have this weird environment where, okay, the CIO is tasked with you need to have an AI plan, an IT plan, but I'm also going to cut your budget. Like, so they are spending money on some things like AI solutions, which every health IT company has become a AI company, I think. Like, there's probably a couple out there that haven't, but for the most part, it's essentially the same thing. It's part of that AI strategy, and so they're going to spend some money, but then like, but how and what am I going to stop spending on? And maybe it's going to be flat, whatever it might be, right? So I think that's caused some uncertainty as well. It is interesting though, right? Like, because you look at it, and maybe this is part of the disconnect as well, is you see the Facebooks and Googles and Amazons of the world dropping $1 million on an AI person, and you're like, something feels off here, right? Like, because if you're an AI person, you can get a job, like, but even AI people, like, you have to be the creme de la creme, to get a job. Otherwise, you're still struggling as well because you can't just say I'm AI and I deserve $1 million bonus, right? Like, you better be able to put up if you're going to do it. So that's also the disconnect that we see happening, and then also I think what's challenging in healthcare many of these organizations, the top tier healthcare organizations, they have billions of dollars of cash, but their margins are losing money. And so they're like, wait, why are you cutting when you have all this cash? And they're like, well, but our margins are bad, so we're trying to address the margins, right? So I think that confuses people in the healthcare environment as well.
Yeah, and there's another aspect to this too, right? Like you talk about the supply chain and the cost of goods. And it has nothing to do, by the way, it has nothing to do with tariffs, although a little bit, but it's really more the cost of everything has gone up, right? Like the global supply chain, the global demand for certain products has gone up. So it just costs more to deliver the same care. This is not even including the cost of labor, right? So
Yeah.
when you factor that in, you go to your point about margin, like I'm offering the same service the same way, but my costs have essentially doubled, right? And so they are looking to make cuts and be more efficient. Now, thankfully, AI and other technologies can help with that. I mean, that's the point of technology, right? To make you more efficient. And so they're implementing that. But what I'm hearing and what I'm seeing is that no one's getting up to do major projects at the moment because they don't know what the impact on their revenues, like the provider revenues, are going to be. Like with all these cuts to all these jobs, like you mentioned before we got on the air here, like Amazon's cuts, right? 30,000 people losing their jobs over time. Like these are significant losses of people who now will not have coverage for a bit, right? As they search for new jobs. And so will we see a decline in patient volumes because of this? And if that's the case, then that's going to impact revenue for these hospitals and for these healthcare providers, which then in turn, of course, goes, well, now I got to start cutting people. And so I think a
Yeah.
lot of people are just waiting for that, right? Is that going to happen or not? Or are we going to recover fast enough where it's just that we didn't have to worry about it? And that's, to me, that's the thing that I think a lot of people are waiting for.
Yeah, and if Amazon's cutting 30,000, there's a trickle down that often happens when they're like, oh, okay, we need to be careful. And when all those cuts are happening across other industries, healthcare is impacted, as you said. They're coming in and now they don't have health insurance, or they're just skipping it altogether because they don't have insurance. So, like that healthcare gets impacted when other industries cut. I think that's going to be a real challenge. It is interesting though, because we have lots of opportunity with AI. That you mentioned it, right? And for many organizations, the only answer for some of their challenges with the workforce is AI, because they literally can't find the right people with the right skill set. So that's also that disconnect, right? Like I need to hire people, but I need people with certain skill set that is available. And so, do we have to be more creative in what we're doing? I think that's going to be interesting to see how that evolves as well.
Yeah, I got into this conversation. I was just, at a couple of conferences. One of them was the Experian Health Conference, and we got into a discussion about RCM, right? Like, and people who do coding, right? And and everyone's looking for veterans, people who know how to do that, because they are using AI to maybe do some of the more junior, more repetitive things, but they need the veterans to kind of overlook and oversee and make sure that what those tools are doing is correct, right? So doing the spot checks, the quality, sometimes even training those things. The challenge we're in this weird time where I go, well, I need to bring more veterans on. I can't find any, right? And to your point, I can't find a lot of veteran people in the RCM space. They're hard to find, they're expensive, but we're not minting new enough junior ones to get there because we're replacing them with AI, right? So it's a dwindling supply is what I'm getting at. And so we're in this weird time. And I got to thinking about it to say, well, I bet you this is happening in a bunch of places. Like, is this happening in cyber, for example, right? Where you go, okay, well, some of the things that maybe a junior cybersecurity person would have done, maybe that's being replaced slowly with AI. So I need more veterans, but I can't get more veterans because we're not hiring the junior ones to turn them into one, right? So are we going to end up with this weird gap? So it's kind of interesting to kind of think about that and going down in the future. But to your point, AI is taking away some of the work that not a lot of people like to do, but that work that not a lot of people like to do is the work that a lot of junior people did. Right. So,
And
are
it
we
trains them. That's a good point.
right?
Yeah, I mean, you're describing a crisis that's a few years out, right? And maybe 5 years out, where, you're right on the RCM side. It is moving to this really higher level stuff. It's like, but how do you get to the higher level stuff if you're new? That's a problem. It's interesting what you said too about like IT projects aren't being done. Yeah, there are some exceptions, a few areas, RCM being one of them. You know, if you can affect the RCM, then we're still doing it. In fact, we have to do it to survive in many cases. You know, the AI medical scribe, ambient clinical voice, that's going full on, full forward, full bore, and that's true for a number of other AI projects. You know, we see where it's automating form submissions for government stuff, or you know, any sort of automation that then helps the people work more efficiently, effectively. We're seeing more of that still happen, you know, and so that's good for a healthcare IT industry, and maybe that's kind of the point. It's dulling the impact that we would see if these things weren't so exciting and weren't happening and helping us to improve. You know, it's dulling that kind of fall off that could happen, you know, and that we could experience if we were in a different environment.
Yeah, you're right. I mean, the problem I've been describing is a few years out, but you're right. Without this technology, it would be the pain would be a lot more right now.
Mhm.
And because I think, for one, a lot of companies are coming out with some really interesting, cool AI tools. A lot of incumbents are having, adding AI capabilities that are allowing people to do more with less. Because in healthcare, that is one of the big, things that's going to be a trend for the next little while. You got to do more with less with the same amount of people. And the only way to do that is through technology. So you're right. There are some projects that are on the go, but I think in general, people are just like, okay, you know what? That whole website refresh, I'm not going to do that. That we are planning to maybe consolidate from 15 vendors down to 3. Maybe that's only down to 10, right? Because I can't take on that much work. That large integration I was going to do, the interoperability project I was thinking of, let's hold off on that, right now. We know we need to get to that. Got to comply, but let's just wait. Let's wait till January, see how that goes, right? That's kind of what I'm
Yeah,
hearing is that it's not gone forever. I just think people are just going, let's see what January brings,
yeah,
before we
you're
really push
right.
the button.
The other trend we haven't really talked about is remote work. Like the impact of that is fascinating. I know a lot of IT departments in healthcare who have essentially gone to remote work. You know, and their office spaces are gone, right? Like they're not coming back to the office because those office spaces have been repurposed. They're now exam rooms. They're something else, right? You know, they often do some sort of hybrid, you know, you have to be in the office this day and we're going to collaborate and have meetings and different stuff, right? But that's interesting. And you juxtapose that with a lot of the big ones that are like, we're returning to the office, including the epics of the world, right? That are like, you have to be in the office and we want you there, and there's value in having it to, you know, oversight, collaboration, etc. And there's some good arguments for return to office too, right? But anyway, that's an interesting one as well, because in many cases, you see people recruiting all throughout the country. So that actually means that you're going to get a swarm of resumes for any job that you post when you're able to hire for, you know, a remote position. And so then it makes the hiring process more challenging because you have so many people applying. So it is this weird kind of environment where it's like it's more competitive because, you know, before when you were hiring, you're like, well, there's 3 people in my city that can do this job, so let's get all 3 of them to apply. Now you're like, oh, we just got 1,000 applications, and actually like 700 of them are pretty good. It's like that's a different problem than what you had before.
Absolutely. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we are talking about the healthcare job market and the challenges that we face. John, you raised a good point there. It is challenging. So, like, what advice do you have around trying to navigate this job market? So, whether you're right now being forced into a job search, whether you're worried and you're looking for a job, like, what advice do you have to help
Yeah.
navigate that?
You know, it's weird for me because Colin and I often say, I'm not sure I'm employable at this point. And to be fair, like it brings up past trauma, right? Like when I was searching for a job and I wanted, before I went out on my own, I was still working at UNLV in the Health and Counseling Center. And I looked, and even back then, 20 years ago, right? Something like that. I was like struggling to get the attention of someone And that is the key in this job market. How do you get the attention of the right person who can help push your resume forward, who can push your, skill set and you forward in this job search? Like, how do you set yourself apart? And so to me, the best advice, of course, is networking with people. And who is your network? And you're only as good as your network. And so that's always been true, because how did you discover jobs? That's, you used to do networking to discover jobs, right? Because if you networked, then they would inform you about a job that you didn't know about. Now we know about all the jobs. They all get listed online. We can search them. They're in databases, et cetera, et cetera. ChatGPT can find them for you, I imagine. I haven't heard someone doing that, but that seems reasonable. But it's like, but now your question is, how do I stand out in a job that is available, because there's this wave of resumes that's going there. And by the way, the bots are doing the first screening. So if the bots are doing the first screening, well, if I don't make it through the bot, how do I make it through? And that answer to me is people and networking with the right people. So, that's why it's become even more important is, who are you networking with? And by the way, that usually needs to happen before you don't have a job. Like, once you don't have a job, that's harder to do, right? I often think about it on our Sway side, right? Like, people who haven't worked with us, doing something on Healthcare IT Today or doing something together and sharing their knowledge. And then they're like, hey, will you do a referral? And it's like, well, if we'd worked together, it's easier for me to do a referral. But we haven't worked together because we didn't, whatever reason, yeah, it's fine. They choose whatever they do. It's like, if you've worked with someone, you have that connection, you've done something when you have a job, then it's easier for your network to validate that you're someone that should be hired. So anyway, I think that's an interesting part.
Yeah, I think, the advice that, I would give right now in any job market, but in this one in particular, is you need to look for your next job now. Whether you want to or not, whether you need to or not, you need to start. And by start, I don't mean like start putting your resume and applying for positions, right? Although that is part of, if you're searching, like if you're not in a job right now, you got to do that. But what I mean is, to your point, you need to build up your network. You need to build the relationships and start those now. You may not need those or need to rely on those for 5 years from now, but you better start now, because it's going to take you that long to build real strong relationships. And there is still a hidden job market. In fact, I think it's growing, because people, when they post on LinkedIn, they know they're going to get 1,000 resumes. And to sort through that, even with a bot, is brutal, right? And so why not just go to your own network and go, hey, do you know anybody? Right? And just, post on LinkedIn. So, as a post, not as a job post, but like just say, hey, does anyone know anybody? You might get a few hundred, right? But referred, and people who are in the know, people in your network. So, you know, there was a book I read a long time ago, by somebody who grew up in the 1950s and 60s, dig your well before you need it, right? Before you get thirsty, dig your well, right? And that's the idea of, I think, what we're both saying is, like, you got to get out there. Now, I would also say that if you are in a job search situation right now, like you're out of work, you're looking for a job, I think it's one of the best things you can do is look around your own community, your immediate community. What city you live, most people live in fairly large cities, right? There's bound to be some incubators, some, business development group, somebody there who does work with entrepreneurs, who does work with, researchers or something, trying to help them, create a company, right? And oftentimes those organizations are desperate for people who have something to share, like advice, expertise, right? It could be marketing expertise, could be IT expertise, could be obviously healthcare expertise. Get involved with that group. Like, get involved. One reason is, sure, you might run into a company that might need your skill, and maybe one day they might hire you. Great. That's, to me, the rainbow. It's not actually that. It's that you will feel good about yourself and start to realize what skills you really have, right? And where you can really make a difference. And you may discover a few things that didn't realize you actually like or enjoy or have. But more importantly, those organizations have partners. And those partners, those funding partners, those are the ones that potentially have some jobs, right? It's the, Siemens might be a sponsor of the pitch competition that maybe you've helped the company at, right? Or it might be Stryker, right? Is sponsoring something or do something. So it's those opportunities that you have. I would say the same thing about volunteering at the local hospital and the foundation. Those foundations have corporate partners, right? So get involved and stay, I won't say stay busy, but that's a way to open your network by doing some work, right? It keeps you busy, keeps you in that sort of work mode, doesn't allow you to become a YouTube doom scroller, right? For 8 hours a day. It gets you active, and I think that's really key. So that would be my advice to navigate this job market. You got to find that hidden job market.
Yeah, that's the big one for me too, is when you look at it, if you go into an interview having just YouTube doom scrolled, right? As you kind of described it, like you're not going to be your best self because you have to like change your mindset from YouTube doom scrolling, this job market sucks, all this, negative stuff into, okay, now I'm going to go to an interview and they're going to see it. They feel it, right? But whereas if you went from, hey, I'm volunteering with this organization or I'm doing something productive to then the interview, I think that plays out better. The other one I'd highlight is when you do that kind of stuff, then you also have stuff to share on social media. And I know some people don't want to share on social media, but man, there's a power in showing your expertise because when they're interviewing, they're probably going to look at your LinkedIn and see what have you shared or what have you not. And it's not always essential. Like some jobs will hire you without that. That's fine. But if they go there and they say, wow, Colin really does have a deep expertise in healthcare marketing, and he shared this knowledge, and oh, he thinks deeply about a certain topic or whatever it might be. Like that can help you in the job market. And sure, anything you share, those people might see it and say, oh, you know what? I'm actually looking for someone who has that expertise. So that can do it as well. So you don't know where that's going to go. And when you share it, you feel good about yourself and you realize, oh, I really do understand this topic to a deep level and that I am worthy of a job. We just haven't found the right match yet, right? Because that's the problem with the job market. It's about timing, it's about fit, and it's a little bit of serendipity, right? Like that you met the right person and hit the right triggers to then, have them hire you. So, I think, do any of these productive things you can do help you with your mentality as much as anything.
Yeah. Yeah. And that's key, right? Like your confidence is going to take a huge blow. I remember I went through it a couple of times, right? Where you just feel like, wow, like no one's getting back to me. No one's like, am I really as good as I think I am? And you go through it. Everyone goes through it. Doesn't matter how good, how long you've been in the market, how junior you are, everyone goes through this. So anything you can do to keep that motivation up, right? And there's saying it and there's actually feeling it. Like I think people say that I'm keeping it up. I'm staying positive, right? But then do you feel it? And I think to the point we're making here is give yourself the opportunity to feel it by going and volunteering, by doing some other things, just by going to a conference, like you don't or something local. Like it doesn't have to be like hymns or anything like that, right? Of course, if you can go there, that's awesome. But just go to something local. Maybe there's a local chapter you can go to, and here's where I think people get a little afraid. Reach out to the organizers, explain your situation and go, hey, listen, I'm out of work right now. I'm looking for work. I'd really appreciate it. Can I just come for the day? I just want to learn. I want to, stay in touch with the industry. I think most organizers would be sympathetic and go, you know what? Yeah, come on, right? Like it's one
Yeah,
person, right? Or hey, we pay for lunch, right? Or hey, they come, but you can't come to this part of it or that part of it. Great, right? But
sure.
the point is to get back
Do
out
that at
there.
Sway Health, right? I mean, we've done that to a lot of people who are searching for jobs, and we do it because I think it's the right thing to do, right? Like, it's good for you, it's good for your mentality, and it's good for the people at the conference because they're probably looking for qualified people. And what's interesting that's played out, and I don't think this was our intent when we first said, sure, you can come, you don't have a job, but here's a free pass, come and enjoy, right? But what happens is they say, thank you for believing in me and thank you for trusting me. So, like, the conferences actually benefit from doing that too, right? Because that person appreciates that you are willing in a hard time to help them out. So yeah, it makes sense. And to your point, they come and they get re-energized, they have connections and they're able to, meet new people and talk to them and see what the possibilities are.
Yeah. Yeah. And so I think that, those are a couple of tactics that I would share. I'll add one more and then I'll ask you, John. Like the other tactic I would say is, yeah, and you do have to apply, you do have to, look online and search. But a lot of times you're right, like that the bot is number one, right? So in my one big recommendation, have two versions of your resume. Have the one that you send to the application site, and that one has to be optimized for the bot, right? It has all the keywords in it, and there's a lot of YouTube videos and a lot of places that you can go to kind of figure out how to optimize that. But that one is not human readable.
Mm.
That one does not leave an impact on a person. So you need a different resume that you give to your friends and you give to your network to give to someone that may know a way to get you in, because that does not go through a bot most of the time. Usually that goes to a person who will read it, and then maybe they'll throw it through a bot. But you've got to pass the person. So I've seen a lot of people who've given me resumes to give to someone else, and I read it and I go, I can't even read. Like it's so dense. It doesn't actually it doesn't speak a human, right? So you need a version that's a little bit more high level, a little bit more summarized, a little bit more punchy, if you will, for a human being to read, and have that version ready as well. And have that one ready as well when you go to these networking events, because that's the one you need to send. I wouldn't send the AI one that's optimized for AI to a person that you actually know.
Yeah, and it's interesting how a lot of it's moving to LinkedIn, right? Like, how much have you updated your LinkedIn, and does it show your skills and abilities and your history? A lot of people are looking there as much as any sort of resume or cover letter or anything like that. It was interesting. I was talking to someone recently, and they were kind of doing their own thing, but they were looking for a full-time job. They were open to it. And we had this really interesting discussion. I'd love what you think about this, which is, from my side, looking at social media, it looked like she was all in on her own thing. And she wasn't looking for a job, but she actually was. And I was like, that's a tough balance, right? Because, in social, sure, you want to take on some side projects. You need to bridge the gap financially and things like that. It makes sense. And like we said, it keeps your mental aptitude up, and it makes you happy that you're actually doing something, right? Meaningful. But it is this challenge, and that was my thought to her, was like, you kind of got to choose, go all in on one or the other, so that you're not sending mixed messages, to the community, that like, hey, I am ready for a full-time position. I'm doing some side work because I wait, because I want to stay up, but like, that's my goal. Or I'm doing side work and I want to grow this into a full thing, and people are doing that as well. I don't know, how do you balance that kind of like perception that you're not looking because you're doing well and life's good, when in reality you really want a job?
Yeah, I mean, so there's one on the one way. I'll just be quick on this one. One, if you are looking and you are doing some side things, but you are really looking, then I think you need to be clear. I think you just come out and say it, because it is hard to pick up a lot of subtlety on social media, especially with all the noise on social media. So I think being blunt, being straightforward, to say, look, I am looking, but I'm doing some side stuff right now. And so what you see in these posts is a lot of the side stuff. I'm very excited about that, but I'm looking, right? And I think you put that at the very bottom of those posts that you make. The trickier one is when you have a job and you want to look for a new one, right?
Yeah,
Because you're
that
worried
makes
about your current one. There, I think it can't be as obvious, obviously. But to your point, I think you need to look at your own social media and go, am I sending the right message out there? Right. And that message is, obviously you want to try to position yourself as a thought leader, but I think there are some subtle things you can do in the language you choose, in the way you post, the timing of your posts, to say, I'm looking, without putting that little symbol on your, on your LinkedIn profile. So lots to do there as well. But yeah, and so many tidbits and things to share. We're at the end of time though, John. We're at the end of today. We could spend a whole episode just talking about tactics.
Yeah, well, and I think it's worth saying our heart goes out to anyone it's a tough thing, and we understand that, and keep fighting. Like, you never know where that next one's going to come from.
Exactly. Just like any sale, you never know where it might happen. It could be someone you bump into at the Starbucks line, right? Like, and on the way to the interview, on the way to the interview you thought you had. So yes, stay up. Watch some good, positive dog or cat videos, and then you'll be all right. But hey, thanks to all of you who tuned into this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung with my friend and Health IT collaborator, John Lynn. Thanks for listening and have a great week.